Hi, this video is focusing on lower hamstring tendonopathy. This is a very frustrating condition for people. We're going to go through quite a lot in this video today. We're going to go through the anatomy, causes, the symptoms, the treatment, and the principles you have to follow in order to get rid of this issue. My name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Lucan in Dublin. So the hamstrings go from here, your sit bone here, right under your glute, all the way down and attach below the bottom of your knee. So your hamstring, there's actually 3 muscles in your hamstring. There's 2 that come down along the inside and attach down here, one behind and one in front. And then there's one that comes down here and attaches down here. If you put your fingers here and you feel those little ropey bits, that's your hamstring tendons, and they can become very sore and very problematic for people who want to be more active and play sport or just be able to run or hike without getting pain. So in terms of the causes of this and why this happens, there are 2 main causes. The first is overload. So you did something that your body wasn't prepared for. So you can see it as either being underprepared for that activity or just a sudden spike in activity. So maybe all of a sudden you did a longer cycle that you hadn't been prepared for, or you played a football match, or went running, or did hills, or just did a more intense session than you would usually do. That's generally the main way that this happens. And in that, your hamstring muscle and hamstring tendon had to work too hard and they tightened up, and that can become problematic, and you can feel your pain there. And it can come on sort of gradually, where you feel it a bit, but it doesn't completely stop you, and you're able to keep going with some activity. But generally, the more you push it, the worse it will feel, and you'll find that you're not actually able to go as fast as you were able to go. You're not able to open up, you're not able to do your activity for as long as you were, and that pain becomes a problem. Another way this happens, if there is an issue somewhere else in your body, let's say along that leg, and you've a foot or ankle problem, maybe it's an old injury, or you've had previous knee surgery, or you've a hip issue, and your hamstring has to work harder than it should have because somewhere else isn't doing its job. Hamstring has to work harder, the tendon gets overloaded, and you can get sore there. So that's generally the main causes for this. It can be a spike in activity or under recovery, where you're doing too much too soon in a short period of time, and your hamstring tendon gets sore and then stays sore, or it can be because of an issue elsewhere in your body, say along that leg, and that hasn't been rehabbed properly, or it's a little bit painful, or you've reduced range of motion, or some issue there, and your hamstring has to do more. If that's the case, you obviously need to address that specific area. So if you have a bit of arthritis in your hip, you'll have to do a little bit more hip stuff, or if you've got an issue with your foot or ankle, you will also have to focus in and do some foot and ankle rehab, as well as the hamstring stuff that we're going to go through. So I hope that makes sense. The symptoms then that people have generally can be described as a tightness or a pain in along here, along the back of the knee. It can also feel like a fullness. It just doesn't feel right, and you don't have that sort of like confidence to go and to open up. If you do too much, it will tighten. Sometimes you can feel it at the start, but once you warm up, you can actually feel okay in your activity. And then it's a few hours later, or the next morning, or that evening, when the hamstring tendon gets sore again. Because of the nature of that, and if you maybe don't annoy it for the next 2 or 3 days and you train again, then you can go with that, and you can actually get through a bit of exercise or training, but again it tightens up afterwards. And if that keeps going, you'll generally be able to do less and less as the weeks go on. So in terms of the treatment for this, there's 2 main things that are going to help it, and there's a lot of noise out there. Things like, surgery, shockwave therapy, dry needling, massage, rubs, complete rest. Those things won't get this sorted for the most part. Could there be a tiny adjunct with a little bit of shockwave therapy? Like maybe, but it's certainly not enough. It's like a 1% thing. To sort this out, you need 2 things: relative rest and strength training. Now the relative rest part is important because it is not complete rest. Maybe it should be called something else other than relative rest. But you have to stop aggravating it, but you can't stop completely. If you stop completely, you will go into this sort of pain, rest, weakness spiral, and that's taking you further and further away from the activity levels that you were at previously. This is tendon in nature. They do not like vacations or holidays where you are doing nothing on it, and they don't like surprises or spikes in activity. So it's important to remember that. So if you have this issue here, by relative rest, I mean if you can still run, you might be able to jog, but you can't sprint. So you should still try and jog. Maybe you can't jog, but you can cycle. Maybe you can't do your hill sprints, but you can still do your gym work, where the tendon will be working and it just won't be getting aggravated like doing sprints or doing hills. So relative rest is a key concept. Just to reiterate, it doesn't mean complete rest and do nothing. That is the absolute worst thing for this, but it doesn't mean annoy it and do too much. It is trying to stay active in activities that you can tolerate. But then the other thing that you also need is strength training. Now in this video today, I'm going to go through the progression from if you're very, very sore to like very late stage full recovery. I'm going to go through a very simple, basic, but absolutely incredibly effective approach with sort of one theme of just loading up your hamstring to get it sorted. But you also need to add in some other general lower body strength training with that, which we're not going to go through in this video. You can see the examples of that in this video right here, a lower body basics gym program, or at home, a lower body basics home program right here. So if you could do those exercises as well and add in these specifics for the hamstring itself. The other thing you need to get right with this is what's okay to feel, and this is very confusing for a lot of people. In terms of getting this sorted, and remember the approach has to be proactive. You can't stop and do nothing. You can't wait for someone else to sort this out and rub it better. You have to do some exercise. So what's okay to feel? It is generally okay to feel a slight bit of pain or slight ache and discomfort. Maybe you'd call it a pain. Like no more than a 1 or 2 out of 10, or 1 or 2 out of 10 as a reaction to the exercises that you've done. So you could do your exercises and feel it a little bit more. The other thing to keep an eye on though is the 24-hour response. It's okay to feel like that for a period of about 24 hours. So 24 hours after the exercise session, ideally you should have returned to pre-exercise levels of discomfort. That might still be a 1 or 2 out of 10, or it might be completely pain-free depending on your starting point. So there can be a very slight increase in discomfort for 24 hours, no more than that. Keep that guideline there. That's very important, because as you go through the stages of rehab, the stuff you start with will suddenly, or not suddenly, but it will then become fine and it will tolerate that and you don't feel anything at all. And at that stage, you actually need to move on to more advanced exercises that will then cause a slight irritation again, because it's a little bit more strenuous and a little bit more advanced on the hamstring muscle and the hamstring tendon. And that's perfectly fine. You'll keep going with it until you can tolerate that, no problem. And then more than likely you're going to have to move on to more advanced exercises again, which will again cause it to be a little bit sore, which can be a little bit frustrating because you're after going through a period of being sore, not knowing what to do. Starting your exercises sore but manageable, and then they don't hurt you. Move on to the next stage. Oh, it's a little bit sore again, but again you get through that, your body gets to tolerate that and they're fine, and then I'm asking you to go on to the more advanced exercise and get that pain again. That is an absolute normal part of getting this better. We need to get your hamstring muscle and your hamstring tendon strong enough to tolerate more load. Some of that is going to involve more strenuous tension on the muscle and the tendon as you go on. So I hope that makes sense, because that's a key concept. Don't get discouraged by feeling it a little bit more as you move on to the next stage of more progressive exercises. In terms of then, there are lots of options in terms of exercises, and again I've done another video on this. Please feel free to look at this video here for another video on this injury. But let's go with the principles that you need to go with. So generally I would start with the day on, day off program. That also varies with people depending on their own conditioning levels and what they're able for. So for some people that will mean doing the exercises and the next day you're not doing any exercise at all, you'll just walk or move about in your day as normal. But for someone who's maybe a little bit more conditioned and able for more, that might mean they do heavy work on this day, high intensity, and their day off means there's still a little bit of lower intensity stuff happening where it's some gym work of some sort, or they're doing some isometrics for their hip, glute or hamstring. So it might not be complete rest. I hope that makes sense. The next principle we need to speak about is something I've touched on already, but it has to be progressive overloads. The intensity of the exercises have to increase as time goes on. The focus of this shouldn't be that you never feel any sensation in the area again. The focus of this is that you're able to tolerate more stressful exercises and activities so that your hamstring muscle is getting stronger, and that's getting you closer to the activity that you want to do. So the exercises have to increase. The stuff we do at the start is fine if you're very, very sore, but it's practically a waste of time if you want to get back being able to sprint and run and jump. Again, I hope that makes sense. And then the third principle here for the strengthening of this injury is that early on, I want you to try and avoid exercises where your leg is extended like this. So the hamstrings come down, like I said, and attach down here. Now, between your hamstring and the bone, there's little sacs of fluid called bursa, little fluid-filled sacs, and they can become irritated in this issue as well. They're more irritated and the hamstring is under more pressure where it has to work like eccentrically where the muscle is lengthened. That's a lot tougher on a muscle and a tendon. And if you're highly sensitized and sore, going straight into an exercise like that is going to make this area really sore. That's going to put you off. And if it gets sore, it stays sore for a long time. So it stops you doing any exercises. So we're going to start off with exercises where there is no real compression through the back of the knee here on these tendons in a bent leg position like this. And as time goes on, we obviously will push it towards these positions. Again, I hope that makes sense. Okay. So let's go through the exercises that you can start with to get this improved, and I'm going to talk about how you would make them more difficult. Let's start in this bridged position here. So if I start on my back like this, we might just start off with simple bridge exercises where here your glute muscles and your hamstring muscles work, but the back of your knee isn't under any pressure or tension at this point. And you might just relax. If it's highly sensitized and it's even too sore to tolerate going up and down, you just go up there and you hold it. But an important point is there's going to be some pain potentially in this. You have to tolerate that. If you're doing nothing and it's sore, you're as well to do something and have it a little bit sore, because as you go, your body will adapt and get better. So don't worry about feeling it a little bit. But this is a very early stage exercise where you're holding your hips and glutes like this, no compression through it. And how you could, improve that and increase the intensity on that would be hold it for longer. So you might start off in 5 seconds, but you might build up to 30-second holds. And again, you might go from 8 repetitions to 12 or 15 repetitions. Another way of making that more difficult is to go from 2 legs to 1 leg. This applies for all the exercises that we go through. You can make things more difficult. You can do all these exercises and go from 2 legs to 1 leg. Another way you increase the intensity is you change the duration. Go from 3 seconds or 5 seconds to 30 or 40 seconds. And then the third way you can progress this and make this more challenging is by changing the angle of your knee or your leg here. So here is the starter point, but it gets more difficult and more challenging as you extend out like this. So one of the latter stage exercises will obviously be something like this. If you started with that too soon, that would be the wrong thing. But if you don't move on to that, you're not going to get back doing your full sport either. Now, having said that, for someone who just wants to be able to walk and hike, maybe you will get better by just, being in these positions here, going on to 1 leg. That might be enough for some people. Again, if they do it with enough intensity for enough time, it could be weeks or months, depending on the amount of time that you've suffered with this injury for. But let's move on to the more advanced stages. So say if we talk about those bridges being the initial ones, the next ones we could move on to a chair or a bench like that, and you might just put your feet in this position here. And again, you're lifting up. That's going to mean that you work the hamstrings a little bit lower and it's a little bit tougher. But these positions in my feet here are a nice starting point. Whereas, for example, if you go with your heels and we keep it at the same angle, and I dig my heels down and drag it back, that's a little bit more intense again. So you can change your foot position here. And again, go from 2 legs to 1 leg, hold it for 5 seconds, build up to holding it for 30 seconds. Do some where you go up and down. Let's now change the angle. So going from there to being further out in these positions here, holding it, building up tension, going up and down. I hope there's a clear sort of progression there in terms of how you can make it more difficult. And then moving on to the sort of final stage, let's use the foam roller here and give an example of an advanced stage exercise. So here in this position, if we use a foam roller, and these are definitely the more advanced exercises. And again, you might start with, say we're at a nice angle and we lift it up and we're holding it there. But if we want to make it more advanced at this stage, we'll go on to 1 leg like that. And then to make it more advanced again, you need to be able to tolerate being out at that angle there and holding it for initially for a few seconds, but as time goes on, being able to maintain that position and hold it there. So you might build up to 20 or 30 seconds in that particular one. A good way of testing it is to test yourself on the other leg, and you need to be able to obviously match both in terms of pain, lack of symptoms and duration of hold. So there's a progression of exercise that you need to do with this. Add these into the gym programs that we've mentioned earlier. The main common mistakes that people make are they stretch their hamstrings or they do passive treatments like massage guns, foam rolling, go to therapists who give far too conservative exercises or aren't sure what to do. They do some exercises that make it too sore, so they just can't continue with it and get discouraged, or they stop completely and they rest and they do way too much. I hope I've covered lots of things in the video there that answer some of your questions, but if you have any questions on this, please feel free to comment below and we'll be glad to help.